Please welcome Jennifer Pope, the Vice President of Sexual and Reproductive Health, HIV and TB at PSI, in conversation with Allison Carlson, Managing Director of FP Analytics.
That was such a great conversation.
It was.
And I'm excited about this one as it pulls on so many threads that have been discussed today. And I'm really excited to be here with you today, Jennifer. Thank you again for taking the time. You know, we're emerging from, as my HO was mentioning, emerging from the pandemic. And in the US, internationally, we are all very acutely aware of the importance of health to our individual health, to our community's health, and to overall economic well-being. And you've spent years working in Cote d'Ivoire, Mali, the DRC, and I'm wondering, from your perspective, and at this moment in time, emerging from the pandemic, what are you seeing as some of the biggest challenges that remain in terms of healthcare access?
Well, thank you for having me. It's great listening to all the different speakers. And I think first I start thinking about gender equality, and there was a recent UN Women report that showcased that we're behind in reaching our gender equality goals under the SDGs. And so already we're behind in having challenges. And I think earlier, Ambassador Russell talked about the effects of COVID. I sometimes still feel in the middle of it, even though it's nice to be with people, but we're also seeing the effects of climate change and what that means for food insecurity, for women in particular, as they're very vulnerable, humanitarian crisis where you see increases in violence. And so already as a woman, there's challenges. Yes, women are very resilient, but the things that they're dealing with just in their day-to-day lives is challenging. And then when we think of those challenges within healthcare, we often see that they don't have agency, choice, or voice in what they need within their healthcare options. And even if they are accessing services, we often see that there's huge stigma, particularly in the work that I do in sexual or reproductive health, where they don't actually have full access to comprehensive SRH services. And that's women, let alone adolescents. And it's often, we forget, we are all adolescents, but we also forget that adolescents have sex and that they have needs. And sometimes it's not by choice. And because of that, we often have systems that aren't responsive to her needs, and that's a huge challenge. And I think we are way behind in a lot of our indicators because of the unresponsive systems.
And you talk about the stigma and in countries, around the world, and also here in the US and in our own. So in that context, and when you think about some of the ways in which you work with communities and with women and with men, how are you working to overcome and address those issues?
Yeah, I think for us it starts with her and her own power, which is very relevant for this today. But I think it's starting at, particularly at PSI, we start with the idea of a consumer-powered healthcare, instead of thinking of it in terms of beneficiaries, which we often think about. And how do we elevate or amplify her agency, choice, and voice? And so often in our programming, we've adopted human-centered design approaches. For instance, we're doing an adolescence program called Adolescence 360 in Nigeria and in Ethiopia and a few other countries. And we started really working with adolescent girls and asking them, what are your needs? And we've all here been adolescents, and so you think, maybe I know what's best. I remember back in the day. Thing is not a secret. I have not been an adolescent for a really long time. So things change and needs change. And so it's really about how do we listen and what are their needs. And when we're working within SRH, often it's not the first thing that comes up to mind, but there's concerns about livelihood and economic prosperity, food insecurities. And so how do we work holistically and develop programs that resonate with them? But in order to do that, we also need to equip providers, and often they have their own biases. And so how do we address that, particularly when we're thinking about adolescents or maybe rural women or people that might not have as much education, and those biases come in to play. And so I think it's also, how do we better equip providers? And often providers are women. And how do we make sure that they have dignified employment? I think we've often heard about community health workers, and they're often volunteers. That's not very helpful. Women are doing unpaid work all over the place. And so we're already setting them up for failure if we're not paying them properly. And then how do we equip them? And we've been doing a lot of work around empathy-based counseling. So they're better equipped to understand, to better listen to women's needs and adolescents' needs, and then tailor programs based on what her needs are. But this is difficult too, because in communities, we're seeing that there's stigma and gender norms. Power inequity and gender dynamics play out quite a bit. We often talk about male engagement, and yet they only have to engage, whereas women do everything else. And so they play a key role within that. So I think working within communities, then how we can hold them accountable, but the role they can play in holding the health systems accountable.
And when you think about that in the places where you're working, in light of so much stress that has also been put on the system and healthcare systems, who are your partners? Who are you working with at the local level to really address some of these systemic issues and make healthcare access more readily available for women?
Yeah. You know, I think COVID showed the fragility of the system, but it also created opportunities. And we see that there was a lot of opportunities within self-care, self-managed care. And I think the more we can think about that as a key component to the health system would be really important. How we can better leverage the private sector to deliver on public sector health goals. And then I think thinking about innovations, not only in terms of self-care and ensuring task shifting and sharing in terms of lower level providers, but I think then also how do we leverage technology to not only improve the workforce, but then create better avenues for information for women and girls and people in general. And I think we need to think about how do we build in feedback mechanisms so that we can then understand how we deliver systems that are more responsive to her needs.
And measuring impact.
Yeah, measuring impact data is really important, getting the right data. I think often we collect some, but we don't always use it, and how best to turn that into action and ensure, you know, we're asking questions not only from women, but also men, and understanding holistically how that is. And I think it also comes down to leadership and women's leadership and having more women leaders in power, and how do you create that, and how do you lift up women and create opportunities for them.
Absolutely. And it makes me think too, when you're thinking about those kinds of interventions, and in the context of a resource-constrained environment where money is limited, resources are limited, how to prioritize the interventions that will have the highest impact, and how do you measure that and track that so they can be scaled and replicated elsewhere. That's just a thought, and leading into another question. We have a question from the audience that I'd love to take, which is related and dovetails on this a little bit. It's from Holly Hatfield-Rogai. She's at UC Davis. And she asks, what efforts are being made to support HPV vaccinations worldwide? And so how are you addressing those types of issues also with resource constraints?
Yeah, I think, you know, just recently WHO came out with some self-care guidance, which included HPV self-sampling. And then so I think it's looking within the systems, what are the barriers, where can we apply different innovative solutions to then help magnify that impact? Because it is really hard. We have to think about partnership, avoid duplication. And so I think some of the work that we're doing is really understanding how can you use self-care as a key entry point to work within HPV and broader in terms of cervical cancer, and then what is the support mechanisms around that? And you know, there's certainly great efforts being happening at the global level in terms of an elimination agenda, and then how does that trickle down to countries? And I think that's where the collective power of all of us is so powerful in achieving some of these goals, and you know, when we have limited resources as well.
Absolutely. And too, when we talk about reproductive healthcare access, you know, this year, needless to say, has been pretty monumental in this country. And earlier this year, seeing the rollback of Roe versus Wade. And, you know, there's actually a great article in FP at the time that was just noting that we are now a global outlier and are joining Iran, North Korea, and Russia in rolling back reproductive rights in this country. And I would be remiss not to ask about that.
Yes.
And also, in light of that, what can the US learn from other countries who are advancing reproductive health care access, even in restrictive environments?
Yeah, I think this year, of course, seeing Roe v. Wade, which had always been in my lifetime, now seeing that my own rights are being questioned and that of my daughters and others and friends and family. And I come from a certain level of privilege, so it's less about me being concerned with myself, but more for others. And I find it racist, sexist, classism. And so there's times that I could feel very upset. But then there's hope, and that's where I see hope in the work that we're doing in other countries and the progress that's being made and the brave people that are fighting for our basic human rights. And I think what we can learn is the importance of sharing and grassroots organizations and supporting people, particularly women, and hearing how we can elevate their voices, but then also supporting providers. There's a lot of brave providers out there that are trying to really understand what are the restrictions. And I think even around language, often people will say, well, abortion is illegal. Actually, in most places in the world, safe abortion access is available. It might be highly restrictive, but it's available, and just tweaking that language and then thinking about what are those innovations. And what's come about that was not available pre-Roe v. Wade was medication abortion and the ease and task shifting and thinking about that and how we can leverage medical ethics to be able to create opportunities. And so we've seen in very restrictive environments advancements, and I think we can learn from that. And I think we always still have to have hope, because I have faith in us as women and also our advocates and companions, men play a key role as well in that.
Thank you so much for your work and really thinking through too and articulating incredibly beautifully how we have a lot to learn from others around the world. And thank you also for being a mentor today and talking with others and establishing those relationships and those partnerships about what we all can do to make a greater impact. So again, thank you for your work and thank you for being with us today.
Thank you for having me.